This is definitely not a crisis. This is what we were expecting to see. And if anything, those really low numbers in New South Wales at 20% were always a very pleasant surprise, but quite surprising. I think we have to look closely at who are those cases. I understand that most of them are young, and we know that uptake of vaccination has been lower in people under the age of 30, and it will still continue to increase. I don't think that we've got a hard group of people that will not get vaccinated in that age group. So some more detailed analysis of who it is that's getting infected. My understanding it's the younger people, how we can increase vaccination in those spots, and keeping a very close eye on hospitalisations, of course. But it's not surprising. We really did expect to see increases in numbers as we opened up. And it's a balance between how much activity there is and how much chance of exposure, and how much protection there is, how much vaccination. We're not going to have a lot of room to move on the vaccination front because the numbers are so high. There probably is still room to move in the under 30s. And then, of course, we've still got kids that will be making up a large proportion of those numbers. So, no, I don't think it's something to panic about. It's what we've expected. Close eye on the data, understanding who's getting infected, and close watch, of course, on the hospital system.
Well, as those cases are rising, the state government has committed to its plan to lift restrictions for unvaccinated residents from tomorrow. Is that wise?
Look, I don't think it's going to make a big difference. The percentage of people that are unvaccinated is really small now. It was very unlikely we were going to get above 95%. Actually, if you just look at 5-year-olds in this country who get standard vaccines that have been around for decades, 95% of our 5-year-olds are vaccinated. So there's always going to be a group that would never be able to vaccinate. I believe that locking that group out indefinitely is not a good idea. I'm not even sure that that small group is going to make a big difference to the transmission potential. If you've got 30% of people unvaccinated, yes, then that's what we know is happening in Europe, and they're the people that are being locked out. But this is a very small number. I don't think it's going to make a big impact on increasing or bumping up cases.
So we're going into a pretty potentially risky period. It's people let their guard down. They go to summer events, Christmas events. What's your message to people going into that period, and how to manage that?
Yeah, I think people should feel confident in Australia. We've got really high vaccination rates. Sure, we have Omicron that's appeared, but so far the evidence is that Omicron's not causing severe disease. We've got very high vaccination rates. It's summer, which means that people are outdoors, which is a much more preferable environment. The virus lives for a shorter period of time in the hotter weather. So we're in a good period in Australia. We've also got not only large numbers of vaccinated people, but recently vaccinated. I will, though, make the advice to people that it's really important to get these third shots or boosters. We're now able to give these at 5 months after your second dose. We know you need higher antibody levels on board to protect against Omicron. That's becoming very clear. So don't defer that booster. I think people sort of saw it as a bit optional early on. About 4 million people now are eligible for boosters with the change to 5 months. That's probably one of the most important things that I think people can do.
Given our vaccination mandates, rules around going into venues are based on those 2 shots, do you think there's a case for making the rules, when the time comes up, of course, for the 3 shots, given the need, particularly around the Omicron variant?
Yeah, look, this is a point of active discussion right now. My understanding is that those people that were eligible for boosters now, like over the last 4 weeks, the uptake's been quite high. That was predominantly healthcare workers, people that were in the phase 1A, and the uptake has been quite high. The aged care workers, people in aged care. The uptake may not be as good as we move into lower risk people. In Israel, when boosters were mandated for everyone, the Israelis saw that the uptake wasn't great, and then they changed the definition of what vaccinated means, like your green pass meant 3 doses. I think we've got to keep an open mind. That could well happen, but hopefully maybe not. And I think we just keep tracking, very close tracking, and we can do this because of the national data systems we've got around vaccination, the percentage of people that are taking up the boosters at the right time. And I think if that's not happening, then maybe some additional measures like counting this as a third vaccine. To be honest, as a infectious diseases expert and what we're seeing about vaccination and the need for a booster, primary vaccination for COVID is looking like it's a 3-dose vaccine, not a 2-dose.